This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dialsing, and the Chief Medical Officer, Dr. Roshan Parasaram. The Minister of Health, the Honorable Terence Dialsing, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to the Chief Medical Officer. Good morning to ladies and gentlemen of the media and all concerned citizens of Trinidad and Tobago listening and viewing. Today is Thursday, the 23rd of July, and this is an unscheduled press conference. We had moved from daily press conferences, if you remember, to 3 times a week. And when we made that change to 3 times a week, we did say, if things change and we need to come before the public, we would do so. Today is one of those days where things have in fact changed. So we are here before the media and before the public to give you the most up-to-date information so that we could have the appropriate level of concern in the society. The first thing I want to say, this is not cause for panic, but it is cause for concern. So panic is never a good reaction to these situations, because in a panic state, we can make wrong decisions, but we are concerned. We have been tracking 2 local cases of COVID-19, which have no international connection, that is, related to someone coming in or an imported case. Our infection control measures have been activated. The new case is a minor that is under 18 years of age and is in fact the daughter of an employee of Republic Bank. I have spoken this morning to Mr. Derwin Howell, the Executive Director of Republic Bank, and video footage from the movement of the employee and the minor within Republic Bank would have shown that there was close contact with about 11 employees of Republic Bank, and all employees have been sent home and they will be swabbed today. The CMO will go into those clinical details. So just like yesterday when I would have spoken to Ms. Karen DeBasey of FCB to review video footage and so on, we have done the same thing with Republic Bank. What are we doing? I would ask that one of the graphics that we would have dealt with on this platform many months ago be now put up so the public can be informed again. Ladies and gentlemen of the media, you may remember this graphic where we said you have 1 person can infect 2, 2 can infect 6, and it goes down. If we looked at the case we had yesterday, where a person who was symptomatic for 1 week did not heed the public health guidelines to stay home, that person was in contact with 8 members of a family and then would have gone out, and we would have to shut down 2 branches of Pennywise yesterday. We would have had to look at FCB. And this is the kind of pyramid and cascade you can have, which I showed this population many months ago. And it is so important now, when we have these 2 cases, that if you are ill, please stay home. Get tested. That case yesterday where someone was ill for a whole week, 7 days, if that person had heeded the advice that we were giving out, may not have had the cascade effect of disrupting so much business activity. So the advice this morning coming out of the examples of yesterday and day before is that once you are ill, adult, minor, please stay home, get tested. We have already started the contact tracing for this new case. That is being done. It's a very robust contact tracing program. All infection control measures at Republic Bank are being taken with sanitization and so on. What do we need society to do? Again, these are very old slides that we have discussed in the past. And now more than ever, all must do our part to prevent further spread. And these measures are so simple, so inexpensive, and I will go through them. Simple. Wear a mask when you go out in public. That is measure number one. Wear a mask. To date, in talking to the Minister of Finance this morning, the mask program, which the government launched under NIBDEC, 350,056 masks have in fact been distributed to date via that mask program with NIBDEC. Field would have received 133,756. All 14 regional corporations, regardless of whether it's a P&M corporation or UNC corporation, would have received masks. Tobago will get 8,900, and Field will get a further 77,044, which will bring us up to about 436,400. This is in addition to the 100 to 200,000 masks which Field would have given out in months prior. So we have in circulation from government and from Field maybe in excess of 600,000 masks. That is a good number, but the question is, do those persons who have received it wearing it and wearing it appropriately? The second thing is keep social distancing. Very important, especially if you are not going to wear a mask. Third, and this is the crucial one for these last two cases, stay home if you are ill. This is so, so important. If you have a fever, and the CMO will go through the clinical signs and symptoms to look out for. If you are ill, please stay home and get tested. Wash your hands frequently. Use the hand sanitizers. Cough etiquette. Cough into the crook of your elbow and all these things. Do like me and learn the hard way. Avoid touching your face. I know it's a habit that we have, but if I can do it and to a large extent, then I think everyone can do it. And all touch surfaces, door handles, and all these things, countertops, especially in the public domain, restaurant tables, all those should be sanitized between customers coming down to sit down to eat. So we are asking persons to adopt these very simple measures as we investigate these two local cases. So let me reiterate before we go to the Chief Medical Officer. We have already instituted our contact tracing for these two cases. I have been in contact, as I said, with Mr. Derwin Howell of Republic Bank. Video footage has already been looked at. And we are asking persons, now that we have a minor who has in fact tested positive, it becomes more important that all the advice we have been given about children, which has not gone down well in some quarters, I am hoping that this new case sheds new light on how we have to protect our minors. We have been, both the CMO and I have been under the gun about the measures we are taking to protect children. This case should shock us into a sense of reality that what we have been saying and advising to protect children is in fact important. The CMO will now go in, after I hand over to Minister Cox, to all the clinical measures and clinical information that he can give out at this point in time. Thank you very much.
Thank you, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Honorable Ministers, members of the media, members of the viewing and listening public. Let me first give the clinical update in terms of the number of tests done so far. So within the public sector, we have 6,244. Total number of unique patient tests stand at 4,712. Repeated tests, 1,532. Community tests, 2,247. The private sector tests up to the week ending 17th of July, 1,534, bringing the total number of tests, both public and private, up to 7,778. The number of positives now stand at 141, and the total number of discharges has gone up 1 to 128, with 1 discharge yesterday. And the hospitalized patients now stand at 5 individuals, including the last 2 cases. So within our quarantine facilities, we have 153 persons, 23 at the Debe campus, 21 at the Tacarigua facility, 2 at Cora, 44 at Home of Football. At the Chancellor Hotel, we have 17 persons. The Cascadia Hotel, we have 44, and at the Regent Star Hotel, we have 2 persons. In terms of the general signs and symptoms that we look out for, just reminding everyone, we're looking at fevers, coughs, sore throat. You can get rhinorrhea, which is runny nose, headaches, body pain, acute diarrhea and vomiting, lethargy, shortness of breath, extreme weakness. In children, we would have seen that Dr. Paul would have indicated that the receptors for this disease are in places other than the respiratory system. Therefore, you can get unusual phenomenon. For example, you can get redness of the tips of the fingers and the toes. Someone, it has been labeled COVID toes, COVID fingers. So there's Kawasaki-like syndromes that we can get, which extreme lethargy, shortness of breath, problems with palpitations, which is irregular heartbeat, that kind of thing. So we have to look for unusual presentations in children as well. With regards to the 2 cases, they are doing well so far. They're in a very stable condition, both housed at the Cora facility. And we would just reminding everyone of the symptomatology. We have our hotlines which are present, so if you or a loved one develops any of the signs and symptoms, please call 877-WELL or 800-WELL. If you are extremely ill, of course, the ambulance services are available, and you can get that at 811. With regards to our health centers doing our swabbing, any health center in the country can do the swabbing, but as we recall, there was 1 health center identified in every county of Trinidad and a few health centers identified in Tobago. Those places will be on our website so that people can actually visit those with the times of opening as well, so that they can visit and have their swabs done during that time. With regards to the tracing thus far for case 139, what we have done, we have found all the primary members, primary contacts, have been negative thus far in the home. So out of the 8 people, we have all negatives returned. Those people will now be followed up for an additional 14 days from the time the individual who was positive was removed from the household, which would have been, I believe, 2 days ago. So they will now be under strict home quarantine, being monitored both by the CMOH as well as the TTPS for the next 14 days to ensure that we follow them up for the full time, and if symptoms develop, they will be swabbed at that time again. But they have an initial swab, all of them, which turned out to be negative. So that is with regards to case 139. The other critical group is the workplace group of the first case, 139. We have contacted so far 7 out of the 9 persons from their primary contact. 7 of them have been swabbed. We are trying to contact the last 2 persons today, and they will be swabbed as soon as we get them. And those results will be available within the next day or so. So we will have the full primary contact list from that individual, and then of course the wider group. With regards to the Pennywise, I know there's a lot of questions related to why Pennywise opened us that quickly. There are 3 reasons. One, we were able to test the person who was the primary contact and visited Pennywise very early. We have acquired Gene Expert machines, which are PCR machines, same sort of test, but is done in a much more rapid sequence, because it takes away a part of the sequencing called extraction. So it goes into a cartridge and it's run in about 45 minutes. So we put it on that machine. We have that machine placed at the Trinidad Public Health Lab. We have 2 machines at the Caribbean Public Health Agency, which are being used at present for COVID, as well as we have one of those machines in Tobago, if you recall. So that's one of the reasons. Again, the primary contact tested negative who would have been in contact with Pennywise. So that's one reason. The other reason, we were able to complete the sanitization process quickly. And they were originally, even if before they got the result of the negative, the CEO of Pennywise indicated that they're going to use an additional cadre of staff from another branch to staff that facility after sanitization to ensure that the persons weren't out in the first run. As it relates to the second case, we have gotten some negative results. So the primary contacts being parents, etc., we have got results for some of them which are negative. That started a little later on yesterday evening. The households are less involved. There's fewer households involved with this particular case than the other case. So it is a smaller group of people in terms of exposure, but we are following all avenues, including as Minister mentioned, the Republic Bank at the Westmall branch. So Minister Cox, that's my clinical update for this morning.
Minister Cox, before we hand over to questions, I want the CMO to alert the public about the new symptomology, which we didn't know when this epidemic started. So persons who experience this may have a heightened sense of awareness of whether they are in fact carrying the virus. And that has to do with the loss of sense of smell and taste. Right. That came out maybe about a month or 2 months ago, which we didn't know at the start of the epidemic. And it seems to have been a precursor before you develop symptoms. So CMO, if you can go into a little bit of detail about that, so people can look out. All of a sudden, I'm not tasting the food, I'm not smelling the food or whatever. If you could explain, please.
Yes, so it is really, as Minister said, that these two new symptoms. It can be and has been used in other countries as a sort of screening tool for persons presenting either what we would have thought before was asymptomatic, but really and truly, when you probe, it's a symptom that you really have to probe for when you ask as a clinician. It's not something that is regularly put out there by a patient when you sit down with them and ask them basically what symptoms you have. It doesn't jump to mind that you can't smell and you can't taste. So most people think it's part and parcel of a viral illness, but it's something that has to be probed from the clinician's point of view, and it's very useful for people to look out for in the population. And of course, if you have any of those things, you can be swabbed at any of our sites, or you can call the hotline to get further information, and we'll get those results as quickly as possible back to tell you what we're dealing with.
Thank you.
Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your question. AZP News?
Hi, good morning, Priya Bihari, AZP News.
Morning,
about the contact tracing. Can you tell me exactly how that is done? How many people do it? Do they call the individuals, etc.? And when they do it, can you tell me how often they call and the numbers that are doing it? And secondly, can you tell me, is the treatment for the minor at hospital, would that be a little different from how you treat the normal patients?
Okay.
Thank you.
All right, so in terms of how we do the contact tracing, so basically what happens is that we depend a lot of times we look at the historic perspective of the patient. So if someone in the general population gets ill and they have symptoms for a week, we have to do a day-to-day history of what and where they went, who they would have interacted with. The primary contacts are generally people who you work with, people who you interact with frequently, people who live in your household. Those are the ones that are not hidden. Of course, if you're going to a supermarket, there are a lot of hidden contacts that we don't know of. So we focus on the primary contacts. We use video footage if we can to see how people move, as we have done in this particular cases. So we're trying to get both from a historic perspective of the patient, and it would depend from one individual to the next how much you can remember. So we do a day-to-day log, so it's almost like a diary to say where you went every day, and we would use that to form the basis of how we contact trace beyond the primary cases, going to secondary going to tertiary, etc. Noting fully well that sometimes you ask somebody at the outset, and these are ill people, and then 2 days later they remember something of importance and they tell you afterwards, and then of course you follow on that trajectory. So it changes based on the perspective of the individual, how best they can recall the events of the day. There are some people that maybe work in the corporate world that have schedules. They are able to tell you exactly where they were at every minute of the workday based on their logs, so they can go back through, so you might get a better history from someone that has that kind of work environment. So it depends on the individual and how much information we can get, but it's a very detailed history that has been taken from the clinicians that is passed to the public health departments through the CMOHs, as well as centrally through the PMOE, and we would coordinate the way we do the contact tracing, remembering we have the contact tracers who will do calling as well. In terms of the calling, once you're in quarantine, we try to do fever surveillance once per day and get histories at least once or twice per day. The police will also be involved in ensuring that persons stay at home and abide by the quarantine, and they normally do call-ins. Sometimes they do visits as well as they do drive-bys. So that's how the police and ourselves operate in a quarantine setting. With regards to the minor, they are treated just like any pediatric case will be treated, so we get the pediatricians involved from the outset. In this particular instance, the symptoms are very mild, so however, we still get the pediatricians involved to make sure there's nothing hidden that we are missing, and they will be given the highest level of care afforded to any pediatric patient.
Let me just make one point here, and I want to thank Prior for asking. When the CMO spoke about hidden contacts, in these tracing exercises, because if a person visits a store and you as a member of the public unknown to that person goes into that store, it is so crucial now that everyone wears a mask. Correct, CMO?
Yep.
We have to assume, as we have been saying from the start of these press conferences, please make the assumption that, one, you may have the virus and could transmit it to someone else, and make the assumption that everyone around you, in your grocery setting, walking down the street, make the assumption that they have their virus. And if we make those two assumptions and you wear a mask, then the chance of this exploding out of control is so significantly reduced. So, public health measure, wear a mask. Once you go outside, wear a mask. And two, if you are ill, stay home, get tested. Thank you.
Thank you very much. 98.1.
And good morning again to the panel, ministers, and the CMO, Stephen Cummings, 98.1
We missed you yesterday, Stephen.
My first, well, two questions, and first one, the Minister of Health, you probably can address this one. The elephant in the room, Minister Dayal Singh, is it that we could very well, say that even though you're waiting on, the official results, that we may be seeing community spread, because we're talking about 2 cases and non-travel, as it were. And the CMO, we are told that there are no commercial flights. I'm not sure. Probably this question can be posed to the Minister of National Security. Maybe the Minister of Communications can pass this on to the Minister. If we don't have anybody on the panel who can address this. We are told that there are no commercial flights operating out of Piarco, but I'm seeing a release by the CAL that they are preparing to engage in flights between Barbados to St. Vincent and the Grenadines and Grenada, with other destinations added once regulatory approvals have been received. I'm wondering if that there have been any recent regulations or updates or meetings with Caribbean Airlines in terms of, in keeping in line with the Ministry of Health regulations. Thank you.
So, Mr. Cummings, let me take part of the question, the issue of CAL. If I read the reports correctly, I think Barbados was being used as a base for CAL to do flights, but you could confirm that with CAL. From what I know, they may not be flying out of Trinidad, but may be using Barbados as a base. But we could confirm that with CAL. Okay? Thank you. Go ahead, CM.
Okay, yeah. So, in terms of the classification, and we have gone through this before a while ago, So when we're dealing with cases, they are classified as either local cases, they can be clusters of cases, they can be community spread, right? So I think at this stage, we're dealing with local cases until proven otherwise, as we have done for case, I would say 116, 117, just before we began to have a host of imported cases. So we're treating it as a local case until proven otherwise, meaning until we can find an external link. So as I said, we will continue the contact tracing, we'll continue the testing, but until we prove that it is otherwise, it is being treated as a local case. The reason we do contact tracing is twofold. One, to find out the source, and secondly, to prevent any further outbreak or increasing numbers of cases. So we're trying to prevent local cases from going into clusters of cases, which is where your primary, secondary, tertiary contacts, if those become positive and those move about in a similar fashion like these cases, then you can be prone to getting clusters of cases, and then beyond clusters, you go into the wider spread, and which is classified as community spread. So for now, we're looking at potentially local cases, and we are trying, through contact tracing and through our public health measures, ring fence those cases so we don't get clusters and we don't get community spread.
Thank you. We go to Tobago Channel 5.
Hello, good morning. It's Kandace Jackson from Tobago Channel 5.
Morning.
Good morning.
I just want to bring some clarification to some rumors that have been circulating here in Tobago. And one of them is that case 139 would have either visited Tobago or been in close contact with someone who spent some time in Tobago. And the other one is in regards to some Venezuelans that were discovered here. They may have entered illegally, and one of them is reportedly showing some symptoms. So I was just wondering if you all could provide us some clarification on that.
Okay. All right. So the Tobago?
Yeah.
Yeah. So as you recall, we would have said for case 139, there were 8 family members. Apparently, on the 21st, I believe, 3 of those family members would have gone to Tobago. We contacted the CMOH right away when we found out that the case was positive. Tests were done on all 3 of them. They were all negative. They are also in quarantine in Tobago, which I believe will be state quarantine in Tobago. So that is under the care of Dr. Tiffany Hoyt, who is the CMOH there, and she has been giving updates. As I said, they have the Gene Expert machine in Tobago as well, and they can turn their tests around in 45 minutes. The contact tracing is going very well. They just have a very small number of contacts in Tobago, maybe less than 5, I would think. And they have already tested all of them except one, which they hopefully should do within the next day or so. And all of them are negative. But out of an abundance of caution, they are still quarantined for 14 days, and they will be retested if symptoms develop.
On the issue of Venezuelans being tested, I would have indicated a few times that Cabinet approved a note in June of 2019, and that note clearly says that all migrants, all non-nationals, you could be Venezuelan, Nigerian, whatever, doesn't matter, are entitled to free public health care measures. And in paragraph 6 of that note, at the end of the note, it says, uncovering all infectious diseases. At that time, we did not know about COVID, but that is a catch-all phrase. We are working with Solnet, which is a local Venezuelan migrant group, and the IOM, and we are appealing to any migrant, Venezuelan, anybody. Once you are symptomatic, you can get tested free of charge, and you will get treatment absolutely free of charge. So this is a general message to all migrants. Let's not just single out Venezuelans, because we have other nationalities of migrants in Trinidad and Tobago. It is government's position that any migrant with any infectious disease can be treated, can be tested and treated absolutely free of charge. It's just good public health measures. Thank you.
Okay, just to add yes? one to the answer, I just got confirmation from Dr. Hoyt that the Tobago quarantine, the way they're doing their quarantine, is in-house with under guard. So that is being done in that regard in Tobago.
TV6.
Good morning, everyone. Urvashi from TV6.
Morning, Urvashi.
So, Dr. Parastram, it's been almost 3 months without a non-imported case. That's like about 6 incubation cycles. People are doubting that this could be low transmissions taking place. From a wider perspective, I'd like to know, with reports of illegal immigrants entering TNT in the hundreds and these 2 cases just popping up, does this now warrant adding some pressure on national security to plug that gap? Thank you.
Well, I mean, we won't want to jump to any conclusions as to the source, right? Nothing is being ruled out at this time as to the source. So remember I said the reason we are tracing is for 2 things: to prevent any further spread and to find what the source is. So we are early on in the days of the investigation to say exactly what the source is with any certainty. However, we have to take all things into consideration at this time, knowing that it is a novel virus and we have seen aberrations in terms of the period for even for persons presenting late on, beyond 14 days, etc. There has been in the literature details of viral particles. Dr. Carrington would have indicated that persons would be shedding viral particles much longer, sometimes months after an initial infection. So all of these things has to be borne in mind when we look at the technical details of these cases. They are not straightforward in the way that they are presenting. As you said, we have 6 incubation periods without a case. So it is unusual. And we have to look at all angles to see basically what is happening. I have been in contact with the virologist at CAFA to let them have a very close look at the samples, potentially having those samples regrown to see what is going on, and having a very detailed look at the viral patterns that he's picking up to make a conclusion. But until we complete the investigation, include the virological bits of it, then we will know and have a complete picture to make a determination.
Before we go to the next question, Urvashi, you may remember that we had Dr. Carrington here, Professor Carrington, who is a virologist at UE, on about 2 or 3 occasions. And she did raise the flag that very often you may get somebody testing positive who may not transmit the disease due to something called viral debris. That is bits and pieces of the virus which are still circulating in the person's system, but may not indicate an active case. So we have to be very careful how we assign fault or blame. We just don't know at this point in time. This concept of viral debris, which we raised here maybe about 2 months ago, and we had Professor Carrington here on Monday, I believe, and she said clearly, viral debris, that is bits and pieces of the virus, which is not active, could give you and will give you a positive case. So we have to be careful how we throw around theories at this point in time, but we are investigating.
You say?
Hi, good morning, Ryan Hamilton Davis from the Trinidad Newsday.
Morning.
First question I want to ask is going back to the advice to stay home if you're sick. Now there are a lot of people who may or may not take flu symptoms seriously, and that they might just consider that it's just a cold. I will take some vitamin C and go on. So what should be the attitude towards flu symptoms at this point in time? And at which point should someone consider, well, yeah, I should go to a hospital and get tested?
Okay, so we need to err on the side of caution at this point. We are still in a pandemic, as you see. So rather than saying, we have flu-like symptoms and it's because of Sahara dust, for instance, it's an allergy of some sort, I think we stay on the safe side, consider it infectious, and let us protect everyone else by keeping ourselves at bay, staying at home. If, as I said, we have the hotlines there, if you want to discuss the symptomatology, the doctors that answer those lines will be able to provide some information back to you. And of course, if they think that you need to have swabbing taking place, they will make the arrangements through the health centers to have that done. So err on the side of caution. Don't think that it's not infectious. Let us think that it is infectious, conversely, so that we don't spread ourselves all over the country, thinking that we have a non-infectious disease, and it turns out after the fact that it is infectious rather than the other way around.
Okay, Newsday, you had another question?
Yes. The second question goes back to the advice of giving of wearing masks when you go outside. Now, the public is being advised to wear masks and so on, but we have reports and we have people that have been seeing in hospitals, in ministries that it is sometimes a mixed reaction. Some people will be wearing masks at some points in time. Other people will be wearing masks. Is it now? Should it be made mandatory now that security guards, administrative members, these kind of people who work in hospitals and these people and these places where infection could actually spread, should it be now made mandatory that they wear masks and other PPE if necessary?
Okay. So in terms of masks, I mean, again, we have seen and I have noted that we have a decrease in the compliance as it relates to mask wearing in the general population, as well as even in my workplace, you find that over the last few months, people are not wearing the mask as they would have been during the height of the epidemic in Trinidad. We are, of course, strongly advising and strongly recommending that once you go out in the population that you wear masks at all times. Of course, if you're ill, you wear it even inside the house to protect your loved ones. But the advice remains that you wear it anytime when you go outside of your home. If you cannot establish social distancing, it becomes extra more important. And of course, in high crowd areas, we ask that you wear it at all times. So the guidelines are out. We have a number of guidelines for different sectors that are in place, and all of them, barring, I think, the school guidelines would have asked for mask wearing. The restaurant guidelines, while you're sitting to eat, of course, you can't wear a mask in that setting. So look at the guidelines that are out there, but generally they universally speak to wearing masks. In terms of mandatory, we had that discussion before. I don't think we are at the point that we're going to say that it is mandatory. The no mask, no service that is being put in place by a lot of business places has made it mandatory to enter those individual organizations. So that is up to the ownership and the business sector to do. But we are strongly recommending, and in light of the new cases, again, we're making a call that people comply with the mask wearing.
Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media.
Good morning.
I have two questions, one for the CMO and one for the Minister of Health. So, CMO, I know the investigation is still underway, but are you in a position to say how real is the possibility that there are others out there with the virus and just have not presented with it, and these two persons are the only one that we've seen so far? Would you be willing to say the level of concern that the ministry has over this? And the question to Minister Diyal Singh, with this in mind, that we're now seeing two cases that aren't linked and all linked to international travel, what considerations are being undertaken by the ministry or by government with going forward with the general election, as well as the guidelines for campaigning, and also with regards to the student sitting examinations right now? That would be the CSEC, CAPE, and SCA.
Okay. So the CMO will address the issue of CSEC, CAPE, and SCA. Right now, any issue to do with the general elections is the call of the EBC, and I will not even venture to get into the minds of the EBC. We will advise the EBC if they ask for any advice. The general advice we give to campaigning, because you mentioned that, is to continue to campaign, but campaign responsibly, campaign safely, masks, manage your entourage in groups of 25, and provide hand sanitizing for your entourage and so on. The same general public health measures we ask the public to employ, we ask candidates, political parties, campaign managers to employ.
Okay.
CMO
So
could deal with the other
second part. With regards to CSEC, CAPE, etc., I think the Ministry of Education would have put out guidelines. We would have issued guidelines to them as well. I think the guidelines are robust enough, given the background of cases in the country, to go ahead with those examinations as they are, bearing in mind if people are ill, when the critical things, again, sanitization, social distancing during the examinations, and if people are ill, that they are not allowed into those spaces are the critical ones for those exams. With regards to how real are the possibility of other cases, so what we're doing now is behaving as if there's a real possibility that these cases are linked to other cases, right? As we have said before, the whole point of community surveillance, which is testing as many people as we can, is to, once the population and the restrictions were lifted, we expected that there would be an increase in movement. With an increase in movement of persons, we expect that there will be an increase in viral illness in general, not only COVID-19, any other respiratory illness, gastroenteritis, etc., which we have not really seen. I've visited a number of health centers over the last couple of weeks, and we have seen that the number of cases presenting to the health centers, to the A&Es with flu-like illnesses remain low. On that background, and even to the hospitals with people with severe acute respiratory syndromes, and those are extremely low and rare at this time. So it is unlikely to have large clusters of communities hidden. If you have a hidden cluster of community spread, you would expect that a couple of those will be severe illness or moderate illness and would present to your health facilities. So we are seeing these two, which we expect as people increase movement, there would be increased viral levels, and we are picking it up based on the community surveillance. Most of them were picked up in the community, and we will continue to enhance our surveillance as people continue to move, so that if we, and of course our targeted surveillance campaign around these cases will pick up any spread related to it. So we hope that, you know, getting the negatives on the primaries is a good sign to start. Of course, they will have to be followed up further, but it is a good sign to start, because usually once the primaries are negative, they can't spread beyond into their secondary and tertiary, so we're limiting spread in that regard. I think Richard has another question before.
No, I think you.
Sure. Richard and members of the media and CMO, let's just go back in time a bit. When we had closed the borders, and you may remember this statistic, we had 19,856 CMO persons coming in.
That's correct.
Both the CMO and I, every day for the next 3 weeks after that closure of the borders on March the 23rd, I believe, I could tell you, we were in a state of almost panic on a daily basis, especially 2 to 3 weeks after that, waiting for the hammer to drop on this country with cases. It did not happen. Then when we started to reopen the economy, the CMO and I again were in a constant state of heightened anxiety. With each phase of the reopening, we were expecting cases. Did not happen. And we were always telling the population via these press conferences that the chances of local cases cropping up as you open the economy and people move, because the virus moves with people, is something that we'll be looking out for, having active surveillance for. The fact that today is July the 23rd, between the 22nd and the 23rd, we have 2 cases that we are looking at. I don't know how the CMO views that. It tells us, as the CMO just said, we may not have that number of active clusters to possibly worry about, but we are coming before you because we are concerned. We are concerned. And that is why we are constantly doing surveillance. We visit the health centers to see what are the numbers of people presenting with flu-like symptoms, and today those numbers are very low. So we have to contextualize all this concern that we have. Thank you very much, Richard.
91.9.
Hi, good morning. Verne, Extavour, 91.9 FM.
Morning, Verne.
I just have 2 quick questions. In terms of the 2 positives, I'm not sure if we highlighted it before. Could you identify how were these 2 cases discovered? Was it that an alert was raised? Did they go for testing themselves?
Yeah. Okay.
And it also leads me to the other question now that persons may be a little bit concerned about community spread and spread in this regard. Some kind of policy where persons report people that may be sick in their communities or their areas. Is there a phone number to call? Is there some kind of policy or, you know, something in place for persons who recognize people that are sick and being irresponsible? What do they do if they recognize something like that? Thank you.
Okay, so the first question, basically both of them were picked up going to community centers, health centers for visits related to their illness, and they were swabbed as they got in. So those 2 were picked up as community cases. So in terms of your second question, I don't know if there's a reporting mechanism for reporting people that are ill, but generally we're asking persons, if you are ill and exhibiting symptoms, to use the hotlines, visit your health centers, and avail yourself of the testing that is available to the population.
Okay, Verne, to answer your question, as a parliamentarian and as a legislator, I will answer your question about whether we have mechanisms that a member of the public can report someone who is ill. We still have a constitution, and in that constitution, there's an enshrined right to privacy. I don't think you want this country to reach the stage where I phone up somebody and say Verne Extavour is sick, and therefore Verne Extavour has to be taken to be tested. What we are asking people to do is to be responsible, and if you are ill, if you have these flu-like symptoms, send yourself, report yourself to get tested. Okay, Verne?
Express.
Good morning, ministers, doctor, everyone.
Morning, Kim.
Okay. Questions can be answered either by the Minister of Health or the CMO. Thanks. Returning to our migrant population without targeting anyone. The unscientific observation of myself, and I would say many others, for instance, where I live, is that there's a huge migrant population. It appears to be increasing. One can see this visibly when you are traveling, going to the grocery, etc. Most of these persons, 90%, 99%, they're not wearing masks. They don't have hand sanitizers. I've tried to speak to as many of them as I can. They don't understand a lot of what is happening. They mostly don't speak English. In every group of 5 or 6, you may find one person who's able to sort of understand you. They just don't understand. And also they're in a whole different country under their own stress and circumstances. It's making them a bit timid, but their population is growing, and we do have a threat, another threat among us. Should we not maybe, when I say target, I mean pay attention to the group in terms of speaking to them in their language, going to them, helping them to understand what is happening and the importance of the protocol of getting tested. This is simply not something I think that this community is able to do on its own. And if the threat is again among us, I know the investigation is pending, then ought we not to be taking every precaution, making sure every person in this country clearly understands what they have to do?
Okay.
Thanks. I think that's it.
So Kim, and that's a good issue to raise. So as we said before, we work with Solnet, we work with IOM, we work with Living Waters, we work with UNHCR. We have printed material in both English and Spanish, and we reach out to that community via these NGOs. So that is an active, ongoing process. So I hope that answers your question.
I just want to add that the Ministry of Communications has a dedicated website on COVID-19 in Spanish. We have sent out advertorials in Spanish. Our daily highlights are also done in Spanish and sent out. Wire 868.
Yes. Hi, good morning. Lasana Live with Wire 868.
Morning.
Again, to the issue of migrants. Does the Minister of Health have any information regarding migrants entering our borders illegally for the last 2 months? And is it considered to be...
Could you just repeat that?
Any concern at all? This would be information passed on by the Minister of National Security. Just want to find out what's happening there.
Well, the last bit of information I had from the Ministry of National Security, when they did the registration exercise, there was 16,500 odd migrants registered. So that's the figure we are working with. But as I say, from the health perspective, we work with Solnet, IOM, Living Waters, UNHCR, and any NGO that serves as a bridge between the Ministry of Health and migrants. And as Minister Cox just said, the Ministry of Communications has all the information for migrants in Spanish on their website. And I think even the newspapers run, even some newspapers, and I want to congratulate you, you have Spanish language section. So all these are mechanisms to reach that particular community.
Okay, I want to go back to 98.1.
Sure.
One question, please. We are not hearing you.
Dr. Parasaram, and I looked at a recent summary of cases of COVID-19 in Ontario by age group and gender, and this was up to July 21st, 2020. In one instant, the cumulative case count when it comes to gender saw males were at some 17,650, while females were at 20,170. Of all the 141 positive cases so far in Trinidad and Tobago, have we been able to see any similar trends in terms of the statistics when it comes to the male-female ratio? I know that some people would say that females, they have a different genetic makeup, and possibly we may have one gender being more susceptible to COVID-19 as opposed to the other. Thank you.
So I don't have the demographic breakdown on me. We can make that available if you wish, but there has not been any research that I have noted so far that indicates that there's a predominance for one sex as opposed to the other in terms of behavior of the virus or susceptibility or clinical, the way you show signs and symptoms. But we can make the data available to you at a later date.
TV6.
Good morning again. This question comes from Sigoni, weather forecaster. She was asking, with respect to the passage of Tropical Storm Gonzalo, if it develops into a hurricane in any case, given that we don't know who may or may not have the coronavirus, what protocols are in place for shelters, etc., where people may be required to come together and live in a communal setting for a few days?
Yeah, so we have noted, and we have been working with local government as well as ODPM for quite a while now, with the same question in mind. How do you, because it's an emergency, people are going to need to come to a shelter as a safe haven, and you can't really, as somebody comes, you can't say you are ill, you can't come in. So it's a different way we have to deal with it, and we have sections set out, and we're working with local government and ODPM to ensure that there are places set out where we can deal with ill people. Now that we have those Gene Expert cartridges that we can run tests in about 45 minutes, we can actually take a test from you, get it back quickly, so that at least we allay the fears of the other persons in there. We make sure we're not dealing with COVID-19, but we are working actively with both agencies to ensure that these shelters are being laid out in a slightly different format as they would have in the past to cater for any eventuality.
Guardian Media Limited.
Hi, good morning again.
Morning.
CMO, would you be at this time in a position to quantify for us how far along in the investigations for case number 139 and number 141 are you all at? And also could you pinpoint a more exact time frame as to when you expect this to be completed?
Okay, so it depends. You can't put a time frame on it, right? It's based on the number of people that we are able to contact. As I said, with the history of individuals, things come up after the fact that we have to go and investigate. So I don't want to put a time frame on it. But we, in terms of our identification of the primary contacts at least, we are well on that way, and we have, at least in the first instance, based on the history we were given, identified the majority of primary contacts, and we were able to swab most of those so far. By the end of today or tomorrow, we will swab the remaining individuals. So I think we are fair way in terms of the investigation of primary contacts. Secondary contacts will follow based on the results that we get for the primary, but I don't want to put a time frame on it.
CMO, just to piggyback on Richard's question, because it triggered something, I think what might be useful for the public is to explain to them the risk of transmission from your index case to the primary contacts, to secondary contacts, to tertiary contacts. So they will understand where our focus lies, especially with primary contacts.
Right. So in terms of your contact, as you go from primary to secondary, so use the example. So somebody has a flu-like illness, they're exposed to 5 persons in their home. Those are your primary contacts. So your primary contacts will be the ones that you would expect to be in contact with for a longer period of time. Remembering the definition of a primary contact is anyone in close contact for more than 15 minutes when you're not wearing any preventative material. So you're not wearing a mask, you're in very close contact for 15 minutes and more. So definitely people living in your home will meet that definition. So those are primary contacts in any given case if you don't move around. As you go from your primary contacts, so you have someone presenting on day 2 of your illness, it depends on when you present and when the infected person comes out of that environment. So your primary contacts, your person gets ill on Monday, we get it on a Tuesday, they become positive and we get them out. The exposure to your primary contacts are low. If person develops symptoms on a Monday and they are tested on the Friday, they exposed for an entire week, which means that your primary contacts would have moved around again for a week. So every case is different, but your risk to your secondary, of course, is much lower than to your primaries, and of course your tertiary risk is lower even still, and as you go down the line, they're quaternary, etc. However, if you test your primaries and you find that your primaries are negative, chances of your secondaries and your tertiaries out of that particular primary becomes less as you go down. However, there's still an outside chance, and that's why we keep the line list, we keep monitoring for 14 days, and we test everyone as we go forward.
And just for completion, the primary contacts so far in these 2 cases are in fact negative?
So we would have tested the majority in both cases. We still have a few outstanding ones which should be completed, I would say, by the end of the week. But so far, all that we have gotten are negative, including, I think, the Republic Bank workers we in the process, the 11 in the first instance, and all 40. We'll be swabbing those between today, I hope, and tomorrow, and we will try to get those results back as quickly as possible as well.
Wire 868?
Yes, thanks again. Minister, what I'm asking is so much how we are reaching out to the migrants, how we are stemming the flow, if we have stemmed the flow of them entering the borders illegally at all. I'm assuming the reason that we close the borders, of course, is not to have additional risk here. Is there any information from the Ministry of National Security in terms of migrants crossing our borders over the last 2 or 3 months?
Okay, so that's a question.
And is there any concern regarding that?
So I think that's a question that could be best posed to the Minister of National Security.
Minister Cox, just to add to a question Mr. Cummings, I believe, asked about the number of males and females. We have 65 males, 76 females in our cohort out of the 141.
Okay, thanks. Newsday? One question, please.
Hello again, Ryan Hamilton Davis again. We just got information at our office. It was a call in that another minor, separate from the one that was mentioned earlier by the minister, had come in from Canada at least a couple of weeks ago and was tested positive. Now, just with respect to the privacy of each patient, is it possible that we could get a confirmation of that? And if that is the case, are we seeing emergence of more minors getting sick?
Yeah, as we would have said before, there was a child previously, and even a couple of weeks back when we started to have the importation of persons, there was another child in that group as well. But I mean, these are persons, because the numbers are so small, I can't say that there's a predominance for childhood infection at this point. But we did have children in the group of persons that were repatriated as well that tested positive.
Thank you very much. Thanks to Minister of Health, Dr. Parasram. Members of the media, our viewing and listening audience, we've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As we go, please remember that we are still in the midst of a pandemic. 2 days ago, the Ministry of Health in the Bahamas confirmed that they saw 20 additional confirmed cases of COVID-19 in that country, which led the Prime Minister to table a resolution in Parliament seeking to extend the COVID-19 state of emergency and emergency orders until September 30th. Additionally, Grand Bahama will be placed on a 2-week lockdown which takes effect today to curb the surge of cases on the island. And this extension comes as the country experiences a surge in coronavirus cases, with Grand Bahama emerging as a hotspot. Here at home, The recent cases of COVID-19 over the past few days is a reminder to all of us that we can find ourselves in the same position as a country if we do not follow our public health guidelines. We cannot become complacent, and we must do what is necessary to protect ourselves and our families. And this will include washing our hands regularly, as the Minister of Health was reminding us today, hand sanitization, wearing our masks, physical distancing, sneezing and coughing into the crook of your arm, and staying at home if you are ill or exhibiting any signs of illness. To not do this will put all of us at risk and erase the gains we have made as a country thus far. As more of us re-enter and utilize public spaces, we cannot take chances that will jeopardize our health. Please be responsible. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe, save lives. May God bless Trinidad and Tobago.
News happens anytime, anywhere. And when it happens, we are there. We report the news in real time. TTT News. Connect.
The Team Up Morning Show.
7 minutes away from 8 o'clock.